again to Healthy Perspectives. My name is Vernon Solomon. In a world where many persons are focused primarily on themselves, there are still a few out there who give of themselves to aid others. Today I had the chance to sit with 4 beautiful young ladies that are reminding us of what it really means to be a health care provider. Let's get their perspective. Ladies, I have to start by saying thank you for taking the time to sit with us on Healthy Perspectives today. Please, if you would introduce yourselves. I've had the privilege of speaking with you, but the public has not. Now start at my right. If you would tell us your name, where you're from, and what you're doing here.
My name is Maria Wilson. I am from Lexington, Kentucky, and I am a Med 4 student at American University of Antigua College of Medicine.
My name is Eureka Phillip, and I'm also Med 4, and I'm from Antigua.
My name is Gloria Ogabi. I'm from Seattle, Washington, and I'm a Med 3 student here at American University of Antigua.
Hello everybody, my name is Anne Ogedigbe, and I am a Med 4 student here at the American University of Antigua, and I'm from Houston, Texas.
And I must say, I didn't realize all of you were Med 4s.
Yes.
Which, nonetheless, you're Med 3. Yes. My apologies. Here's a question I have for you, though. Why med school? Why the passion, I take it, to become future physicians? You could probably, all of you from my dialogue with you, you're brilliant young ladies. You could be doing a number of things. Why are you here? And again, let's start with the left. We came from nowhere.
I decided to go to medical school because of my experience when I was 11 years old. I was hospitalized and we were traumatized. We were not sure what I had, and a lot of the doctors and physicians came with a number of diagnoses that ranged from AIDS to cancer to everything under the books. I was actually in the process of going for neurosurgery in 1997, which was not something that hospitals were equipped for at that time. So because of that, I decided that as a physician, I would like for my patients to feel comfortable. I would like for my patients to understand that you don't have to go through this medical trauma of guesswork. We will do the best we can and not just settle for mediocre.
That's admirable. Thank you. And yourself?
My interest in medicine started in high school. I just really enjoyed the sciences, especially biology. I like to problem solve, and just the complexity of the human body and how it's put together and what happens when things go wrong and how to fix it. That really got me interested in medicine. And as the years went by, when there are sick people around, I kind of started to take notice of that, take particular interest, understand what's going on. When I go to doctors' offices as a little girl, I would ask questions, probably more questions than they were expecting me to ask, but I kind of always looked forward to that. I like to understand the whys of things. It wouldn't be enough to just tell me this is what it is, case closed. I need to understand the why, and all that. I want to be a pediatrician. That's my plan, and I enjoy working with children also over the years. That's something I've enjoyed. I like teaching. I enjoy the teaching aspect of healthcare, helping people understand what's going on and simple things they can sometimes do to either prevent themselves from getting sick or even coping better with their sickness. So I enjoy that.
I don't think you'll ever stop asking why. And yourself?
Yeah, well, my interest in medicine actually started when I was about 12 years old. I saw Feed the Children commercial, and one thing that struck me was that they were saying that children are dying every day from vaccines that are readily available all over in the world. So I was like, why aren't they able to get that vaccine and whatnot? And they keep saying it's about donating money, but like, I don't have no money. Like, I would like to donate more than money. So that's the interest in becoming a pediatrician started there. And as I went through high school, I actually did like biology and all the sciences. There was accounting, but then I had to choose in 5th form. We had to write an essay about what we'd like to do in our future careers. So that really started the foundation there. And then I progressed and continued with the sciences. And then during my undergrad years, a lot of family members had like different illnesses and different problems, and not being able to know what to do, how to help, that kind of really got to me. So I'm a type of person who like to know why this is happening, how it is happening, and what I can do to fix it. So that's really my interest.
So you wanted to give not just monetarily, but give more of yourself to these causes. Very good. And I think we'll touch on that again in a minute. And yourself?
I think my passion really started when my mother was diagnosed with cervical cancer when I was in middle school. And just going through that experience emotionally and talking to different physicians and really understanding the different approach that my mother took after she was diagnosed with her lifestyle and the choices that she made. She really took a different, like a holistic approach. And I really learned a lot from her and her involvement with the community. So I think that my upbringing has been the most influential on me, and really doing a lot of different community service events, being involved in sports, and just living a well-balanced, healthy lifestyle. And so I think that it's important to inspire other people to take responsibility for their health, as well as the determinants of their health. So that would include their diet, remaining active, and also like their emotional and mental health as well. I feel like a lot of times people ignore all aspects of health. It's not just, the physical ailments, but to also acknowledge how you feel as an individual can also impact the way that your body will ultimately function.
Exactly. I was going to ask as far as challenges that each of you have faced, but just listening to your life stories, if you would, in brief, you all seem to have had a challenge of some kind, but you didn't let the challenge keep you down, whether it be family or so, but you've tried to rise above it and find solutions to that. But I will ask, as far as challenges are concerned, even in medical school and not just the education itself, because that itself is, is a challenge, right? But to get the message across, have you been able to start at an early age or at an early point in your life and in your careers or career development to achieve that? You said with your mother, and you wanted to get the message across, even yourself, to be the person out there, not just financially, but be out there helping people. And both of you said similar things. Have you been able to do that so far?
I would say so far yes, because of the community work that we've had here in Antigua. Mm-hmm. The school has provided us the opportunity to go within the community. We get to do beach cleanups. We get to go to such places as Amazing Grace to work with the people who live in that establishment. But I really felt that for me, my own personal experience came from working with the Antigua and Barbuda HIV/AIDS. We had the opportunity to talk to individuals who are afflicted with the virus. So I got a one-on-one sense of what the virus does to somebody, not only physically, but as well as emotionally. When you say you have this virus, you think of me as the individual, but everybody, it's more than just you as the person. You have your family, you have your friends, you have work, you have your future that you already envisioned. You envision this wonderful thing that you're scared might never come to pass. So being here has definitely given us the opportunity to go and talk to people one-on-one, as well as the community as a whole. So I appreciate that.
Very commendable.
For me, my experience was more school-based. In Med 3, we were assigned to go to different clinics throughout the community of Antigua and kind of shadow physicians and really get a one-on-one first-hand experience of patients' experiences, their ailments, and really talking to them and understanding what they were going through. And so I was completely astounded by the impact that these physicians had on the locals, and just the way that they would talk to them and share information. I think that health literacy is very important. It's not just about being a health educator, but explaining things in detail so that the patient can understand what they can do, what they can change, and what needs to be done so that it can prevent future ailments.
That's very true, because an individual we can even talk about HIV and AIDS, and if the patient doesn't understand what that means. And do you find that enough education has been provided for individuals that both have the disease and even people, the lay individual, because some people are still afraid to be around a person that has HIV/AIDS?
I feel like we're doing a lot. However, I don't think it's enough. A lot of people still have that fear that if they talk to somebody who has the disease, who has the virus, they are going to be affected. So it is a huge taboo when it really shouldn't be, because nobody really understands that you have to have unprotected sex. You have to, if you're an HIV positive mother and your baby isn't HIV positive, giving breast milk you will be able to contract the virus that way. You would not be able to contract the virus from kissing or sharing a utensil from somebody who has the virus. So education is being given to a lot of people, and I feel that even within the community, even within the people affected with the virus, they try to talk amongst themselves to say, okay, it's okay, let me try to encourage you, let me try to help you. Don't feel so bad about this virus, because it doesn't mean that it's the end of the world, because they're scared. They cannot go to work and tell them, okay, I'm sick, because it's really hard, but people are still fighting and people are still struggling to continue to educate, and that is a very important thing. That is something that has to continue, because eventually when we get enough people educated and when we get enough people willing to understand and willing to listen, this is when we can see results. This is when we now feel accomplished in the work that we're doing.
You're very true. That's very true.
Just to add on to what Ann said, I think a lot of that can stem from integrated partnerships and kind of educating the community at large, not just the people who are infected with the disease, but everyone should be educated on these chronic disease, lifestyle choices, everything as a whole, because it can really uplift the community. And I think that a lot of times we avoid minority health disparities, and those are the things that we should be focusing on the most, especially here in the Caribbean, where there's so many, people of African descent. And for me, that's always been a passion of mine, because it's our people, and we have to take responsibility because no one else will do it for us. So with us being minority physicians and being able to establish one-on-one relationships with those of our own community, I think we will have a larger impact, because they'll kind of initiate trust in us, and we can serve as liaisons and really, I think, make a larger impact on their life as a whole.
Very good, very good. We're going to take a quick break, but when we come back, I'd like to find out what are some of the other areas you think we may need to focus on in our community. We'll be right back. Before the break, we had spoken quite a bit about HIV/AIDS, but my question to you is now, what are some of the other areas that you all are passionate about that you think the community also needs to be aware of, or that we may need to raise the awareness of in the local community?
I think diabetes is a very prominent issue, heart disease. I think those are two of the major illnesses that impact the most amount of people. I don't know if you all agree, but I think that with those two chronic diseases, they can be prevented, and that's something that can be changed with the right choices, like we said, the right education. And for us to be able to make an impact, I think that it's important for us to take heed to lifestyle choices, not just trying to fix everything with treatment and pills and medicine. It's more, you have to take responsibility for your health and what you want to actually come about of that. So
it's very true, and I agree with you 100%. Yourself?
Yeah, well, I think sickle cell as well needs to be put in the spotlight a bit, especially, sometimes, as Anne told me before, there's still a bit of stigma. People thinking it's infectious when it's not, it's inherited. And, fear with employees trying to hire people with the illness and whatnot.
You're from Antigua. Do you think people Are people really know what sickle cell is and the impact that it can have on a person's life?
Well, I grew up in a family who knew about sickle cell.
Okay.
So when I heard that people in Antigua thought it was infectious, I thought that was strange, you know, because everybody around me knew what it was. My dad has a trait, my sister has a trait, and I had a younger brother who passed away from complications because he had a full-blown illness. I also had a friend who passed away from the same thing. So I don't really think, well, in my circle, no, but from the surveys we have done in the past, the public still believes that, you know, it may be infectious and whatnot.
You said surveys. What are some of these surveys that you have done?
One of them was, I think Anne was the one Anne alluded to. That was done last semester, and it was like 10-question survey, and it was just asking basic questions like, do you know what sickle cell disease is? Do you know what the trait is? Has a doctor ever told you that you have it? Do you know anybody, you know, that has it?
Okay.
And things like that. So that was like the first sickle cell related one that was
that have been conducted.
used, yeah, that was on last semester at the health fair, and it was based on data gathered from that that kind of, you know, are moving on to some other surveys, you know,
Okay.
to ask more specific questions and actually see what
The
community,
impact.
yeah.
What were some of the other things you saying? Anne was the one who did most of this.
Sickle cell group did it, but I was saying she alluded to that survey.
Okay. What was some of the other information you found in the survey?
The survey that we conducted last semester at the health fair basically gave us the insight that the Antiguan community doesn't know what the disease is about. They do not understand why it occurs. They might have heard, most of them said that they heard about it, but they didn't understand what it was. They didn't know if it was infected, if somebody was infected with the disease or not, what to do, if they should be scared of it or what the situation is. All they know is as long as it's a disease, they need to run away from it.
Okay.
And that wasn't the that wasn't the idea that we wanted to, that really wasn't the data that we're hoping to get. We're, especially being from an African descent nation, we were hoping that more people would know what the disease was about. A lot of people would be aware of the crises that could lead and the complications that can lead from having the disease. But for most of the data that we collected, a lot of people just basically said, I know it's a disease, I know I need to be aware of it, and I need to stay away from anybody who has it. Yes.
Now, I could not be an educator if I didn't ask this question, and it won't be a scientific question, but how would you explain sickle cell to someone who didn't know what it was? Any of you, how would you explain?
If someone didn't know what it was. Okay, well, it's an inherited disease, and it's not infectious. And what happens is your red blood cells change their shape and become sickle formed. So normally they're round, but they can take like a crescent shape. And once those crescent shaped blood cells become clogged together, they can lead to other problems and affect your spleen, and you can get tired and have different attacks and things like that. So a way to kind of manage that is your fluid intake. Some people say that you can use folic acid supplements and get a lot of rest. So I guess that's how I would
And I would have to give you an A+.
to be, very simple.
Because of the complications associated with it, the pain, the fatigue, what are some of the things that you all have found also that we may need to inform the community that they should not do if they know someone who has sickle cell?
One of the important things would be just being aware of the effect of sickle cell disease on the body and the increase in oxygen demand, like when you go hiking here in Antigua, or you go to places with high altitude, just for people to understand that the reason why you get tired with the disease is because red blood cells that are no longer the right shape, can no longer hold it as much oxygen as they should, and so you kind of feel that you constantly need more air, and that whole situation worsens when you go up on high altitude.
Good. You get an A+ also.
I would say one of the things that we should not do is just look at the person as what people say faking.
Yeah.
They are not faking. They are literally tired. Like she said, they do not have enough oxygen going through the entire body. So at times you're going to see them saying that they are tired and they are in pain. Normally when we say that somebody is in pain, we're like, okay, where's your injury? Where's the redness? Where's the bump? They don't have to have redness, they don't have to have bumps, and it's not going to be secluded to only their hands or their feet. Imagine your entire body from head to toe. This is what we need to be aware of. This is what we need to understand. They are always going to be tired. They're going to, if they're not given the proper medication and if they don't have enough rest, fluid intake, and they're not aware of their diet as well, this would become a crisis. So we need to realize that sickle cell doesn't mean patches, rashes on your body, things like that. You literally feel tired, exhausted, and you are going to be in excruciating pain with no symptoms on your body at all.
Very good, very good. And one thing that we have found that has been on the increase is smoking. And I'm sure in your research as well, you're finding that smoking, based on the oxygenation factor, seriously affects someone who has sickle cell. The smoker or being around someone, the secondhand smoke, can really complicate someone who has the sickle cell. You guys have explained in detail, basically, your passion for being out there in the community, as well as what you've done with sickle cell. What else have you all recently done as it pertains to sickle cell? What are you doing?
Right now, well, in February of this year, we started the Sickle Cell Association student chapter here at American University of Antigua.
Okay.
And that we're really proud of,
yes,
because this is going to be a research-based group. And when we say research-based group, it means that the majority, I'm going to say about 95% of the work that we do will be research. So we'll be looking at different literature and trying to compare the information that other islands within the Caribbean have gotten and other surveys that have been done, and want to see what they have done to help their community and see if it's something that we could come here and implement in Antigua. I know that most of all three of us are from the States, and we want to be culturally sensitive to the Antiguan community also. We want to make sure that when we go to talk to the community, we're representing ourselves in a positive way, and we're talking to them respectfully so they understand that our job here is not to look down on them, but to actually educate and help them in the best way possible. So with the Sickle Cell Organization that we are all executive board members of, we hope to really bring information to the community, education, as well as being able to collect data to say these are however many people in Antigua that we believe have the trait. But that cannot be done on our own by making up numbers. We have to go within the community to do that. So we do have a lot of plans on getting that research and getting those projects on the way.
Also, I wanted to say, we also recognize that there are things we can learn from the people here in Antigua that already are dealing with the disease. We can look at research, we can gather data, but there might be things that the family already dealing with sickle cell has found to be helpful for their own child, which we may not find in the books. And so we recognize also that this is an opportunity to also learn from the community in the process of helping to educate.
In that same regard, being able to share that information, that those people, how they've been able to benefit with those maybe newly diagnosed sicklers as well. You guys have done a phenomenal job, and I really appreciate you being with us. I really hope that as the research continues, you'll be able to come back onto Healthy Perspectives so we can share that with the local community here in Antigua and Barbuda. Thank you very much. We'll be right back. It is truly wonderful to see our youth taking such initiatives so early in their lives, providing information and increasing awareness to such things as sickle cell disease and sickle cell trait, especially among those that may be affected here in Antigua and Barbuda as well as their families. Please let's keep the dialogue alive as it pertains to sickle cell disease. If you have questions, please feel free to contact us at bewell@auamed.net. Take care of yourselves, please. We thank you for spending some time with us today and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda. May your perspective always be a healthy one.
Healthy Perspectives, an AUA ABS initiative offering you a positive view on health.